Hello and welcome to another episode of Mask or Peace Theater. I am your host, Professor James Pretentious. Today we have a panel of medical experts who will be helping us deduce the effects of COVID-19. Will it end our society as we know it? Are we all going to turn into zombies? Stay tuned to hear their expert opinions on this fact.
Proverbs 11:14 says, "Where there is no guidance a people falls, but in an abundance of counselors there is safety." And it is my pleasure as the senior pastor of Bethel Baptist Church to introduce you to a part of our health team that we've assembled over the past several months, and we've sought their guidance at a number of points, and it's been a tremendous blessing to us as we've sought to be able to meet together as the people of God, gathered together in ways that guard our safety. So without further ado, here's a portion of our health team, and so I'm going to ask them to give their name and just a little bit of their story as far as COVID-19 goes. So let's start at the other end of the room with Jessica.
Hi, I'm Jessica. I'm a PA, and I started out with COVID working in the urgent care, and then I actually ended up volunteering in the ICU in the early spring just because of all the number of cases. So I have seen a lot of COVID in the last 10 months.
And my name is Alan Hunt, and I work at NCMC as well, and I work with anesthesia, nurse anesthetist. So I've seen a lot of the effects of COVID just in the patient population, working in the OR, being a little bit higher risk in the OR from what I do as an aerating event. Working with a population in OB that have active COVID, and so that's kind of been my exposure to the pandemic.
My name is Andrew Canterbury. I'm a critical care nurse at the Greeley Hospital here at North Colorado Medical Center. I've been there for about 13 years in intensive care, so I've seen a lot of different disease processes and some more minor pandemic type things come through before. I've been working in COVID as a charge nurse, a SWAT nurse, a staff nurse, and also as an Air Force critical care air transport nurse since March when it first really started, and kind of a little bit in late February as well. So been working with that pretty much daily, and sometimes longer than daily shifts and weeks certainly. So that's my background.
Excellent. Well, thank you guys for joining us, and I'll try to make sure that the questions that we ask put you guys in, give you the opportunity to really share that wisdom, because for us, I know that we all see the same headlines, we see the same stuff on TV and on the internet, and but what we don't see as the elders don't get to see and don't have to see the kinds of challenges that you guys face. So thank you for what you do. Thank you for standing on those front lines, as it were, and for bringing your wisdom to bear on how we as the people of God are called to act in Christ. One of the questions we received was where you guys receive or where you find information and updates, and how we as lay people can maybe make sure that we're up to date and have a handle on best practices. And I know that some of this stuff gets a little bit more technical, and that's okay, but for some folks that's exactly what they want. So I'm going to toss this one to Jessica to start.
So, I read a lot of different sources. One of my go-to for medical sources is Medscape. And like Andrew was saying, it gives you a good summary of top studies. I like to go in and actually read the studies, but that may be over some people's heads if you're not in medicine. And I also like the CDC. I look at Johns Hopkins. And sometimes sources, I talk to colleagues. I talk to our infectious disease specialist or my colleagues on the East Coast. I have a friend that's on the Indian task force in India for COVID, and I talked to him. So I think it's kind of going through all those, sources for me. One of the things I've noticed is studies. We always think a study means that that's fact.
Mhm.
And a lot of, I mean, this virus is 10, 11 months old here, so we don't, we haven't had years to study this. And you can look at a study and see, somebody can bend it however they want the audience to read it and interpret the results.
Mhm.
So you have to be careful when you're reading a study not to just say, oh, that's the fact.
The vaccines,
Uh-huh.
I mean, this was presented as a scientific argument that vaccines were related to mental health issues. And the data didn't really support that as it teased out. No data really seemed to support it, and the guy was kind of ostracized from the scientific field, and he doesn't do that anymore.
Mhm.
But the lasting impression that made is still, we still see the ramifications of that echoing through our society. It's a powerful picture that people have latched onto. It's simple for them to understand, and we still see kind of the whole process play out where people are still, they don't believe in vaccines anymore.
Mm.
So we can see how a scientific study presented with an idea in hand before the science was done. They were leading somewhere. They wanted to go somewhere with that study. You follow that out and it can have lasting implications. But I think the thing we need to rely on is that the scientific field, the scientists who actually tried to duplicate that study, they held up their hand and say, wait a second, like, that we're not getting the same results. Like,
Yeah.
excuse me, but this looks different from what you were telling us it would look like. So we can't verify that. And that's the model that we want to support, is that, hey, just because you have an idea, just because one study says this is something that's fact,
Mhm.
doesn't mean that we're taking that into, that we're believing everything you tell us. Like, we have to back it up. And unfortunately, that's why it takes time to kind of tease out those bad studies, or those studies that have, they have a method or a model that they're trying to find through their study. They have an idea they're already trying to find. And so that's why it takes time, unfortunately, to kind of tease out the bad science with the good.
Yeah.
The other thing I wanted to say was, I just want to encourage everybody, like, Medscape's a great resource. If you don't like Medscape for whatever reason, another simple tool you can use is Google Scholar, and that will almost get you directly to scholarly works. And so if you read something, you're like, that's new, I haven't heard that yet, or I don't know if I believe that, you can just type in Google Scholar, and then type in what you're searching for. And if you read a headline, just type in that headline, the keywords will be in there. You actually go to that study itself. And the abstract itself should be freely available, so you can just read the abstract real quick and say, well, okay, well, this kind of gives you an idea of what they're trying to prove with the study.
Andrew, how about you?
I personally have a subscription to Medscape. It's free. It doesn't cost, anybody can get it. You don't have to be a medical professional or anything to sign up for Medscape. And they send out emails, I don't know, what is it, once a day or twice a day sometimes. I mean, they'll get all sorts of articles. And I agree that that's a pretty good source because it's kind of the Cliff's Notes.
Yeah.
And then, but it'll reference specific journal articles like The Lancet or JAMA or any of these others that are professional. If you want to know more about the specifics of a certain study, you can go look at that. There's also a comment section, which I always take with a large grain of salt, because the comments are very often not by medical professionals and often not comments by people. It's very politicized. It's kind of the political COVID. But what I have found about that is every now and then you'll see somebody actually make comments and reference sources that are very legitimate. And so sometimes it can be helpful, but you definitely have to tease that apart more. Up to Date is a common medical source, but that's a subscription service.
I did want to say this, to follow up on the original question, do you guys have any secret sources of information that the rest of us don't get?
Yes. The hospital. I mean, we all work within the
Experience.
hospital. We have
Experience.
colleagues. We have people that have seen different things, ups and downs and troughs.
We talk to the infectious disease doctors like on a regular basis. You stand in the hall and you talk to the neurosurgeon, and so that's not something that most people have contact with.
Yeah.
So which actually leads me back to a point that you were kind of just referring to, and that's the fact that, not everybody even has the ability or interest or capability of really reading Medscape for that matter. I mean, it can be overwhelming. It really can. And some of those articles do end with question marks and exclamation points. So I think really if you really question and have doubt, talk to your primary care doctor, talk to your primary care physician, because they're going to be able to know your specific situation, because everything within the context of you is different than someone else. It's very complex. There's no one size
That's a
fits
good
all with
point.
this.
Yeah.
So talk to your primary care physician, talk to somebody you know and trust in the medical community that knows you and can take the information that they deal with daily and put it to you within your context of your relationship and how you know them and your background. So I think ultimately most physicians are happy to do that.
Yeah.
And physicians can be all over the place and have different opinions about things, and that's okay. But as long as they're not contradicting the idea that hand washing is best practice, always has been, always will be. Masks stop droplets, that's helpful, but it doesn't necessarily stop the virus. So mitigation is really the issue there. Social distancing certainly can be an issue. We're seeing more and more cases of getting together for birthday parties and the entire family comes down sick and those sorts of things. We can talk about that more later, maybe with other questions, but social distancing does have some impact just because it's mitigation.
Yeah.
And so the same mitigation things we've done for influenza and don't go to school sick, don't go to work sick, call your doctor and ask them what they think. If you have questions. The general internet, I think, is where a lot of people get their COVID information, right? YouTube and things like that, Google search. So I think you need to have a lot of caution about that because there's a lot of legitimate medical professionals who are barnstorming one concept or idea. For example, one physician did a very good demonstration of how completely ineffective multiple different types of masks are at containing vapor from a vapor cigarette, which nothing contains except for a military gas mask.
Yeah.
And it illustrated very well the fact that masks of any kind really don't stop the virus itself. But that shouldn't be the point. And when the public is looking for black and white, and the public is needing a black or white, yes or no type answer, first of all, that's unrealistic, as Alan said. The science is evolving. Our understanding of coronavirus is evolving. There is no black and white, but yet that's what the public, and especially politics, is demanding.
Yeah.
Is a black and white answer because it's very polarized. There's a yes or no vote. You vote for Trump or you vote for Biden. Nobody remembers that there's like 14 other people on the ticket because all those gray areas get forgotten.
Yeah.
And the same thing goes with the information about, for example, that physician's demonstration was a very great demonstration about how you can't stop smoke vapor. But is that relative to the droplets that are actually the high concentration where COVID exists? There's lots of masks that stop that. So the illustration is arguing, and this is by a legitimate physician, the illustration is arguing one point. And so the public sees this general information and says, well, it's coming from a doctor, and I saw the demonstration firsthand, it must be legitimate. However, what they don't understand is the goal is not to stop smoke vapor from a vape cigarette.
Right.
The goal is to stop the large droplets, which science, for a long time, has proven falls within 6 foot, and that's where that 6 foot number comes from. Standard droplet precautions have been around for decades, known for other disease processes. And there's droplet precautions, say if you're outside of 6 feet of the source of the droplets, then you are at relatively low risk. Not zero risk, but low risk.
This is an interesting thing because when I see people arguing and debating and all the rest, that frequently what comes up, it's very clear that people are looking for, they want to know what side you're on so that they can know whether or not to condemn you, right? And it seems to me that this is part of the problem within the church is that we have to be able to recognize that urge and push against it and to be able to say, like, I actually am not on the opposite side from any other believer. We're actually united. And that means that instead of looking for reasons to approve or condemn, I should be looking for ways to encourage and build up and to point people to Christ. But that's not how that's not our default even as Christians, even as redeemed people. We still have that, what Scripture calls the flesh that wants to rise up and convince us to fight again, wants to rise up and convince us to hurt one another and all that. And it seems to me that having a number of different ways to access this information is great, but it's only going to actually make a difference in how we treat one another if we remember that our first calling as Christians is to love one another and to represent Him to a world that desperately needs redemption. And this is a great time to be remembering that, precisely because the fear that a pandemic creates demonstrates how much we as human beings fear hurt, fear illness, fear death. So.
And I think we need to remember that while there is not a black and white answer, we can love and support each other by taking what each individual knows and putting it together, like you said, and coming up with the common theme of, okay, well, what are going to be our standard protocol? Understanding that that's not going to be fixed right now because new information is always coming in. We have to adapt and change. And the CDC website and our government in general has done a good job of honestly trying to do the best. But the answer, the yes and no, the black and white, it moves, it changes as we get more information, as we learn more, as more cases evolve. You have to be willing, you have to be flexible to listen and respect and understand where other people are coming from, and then come to common ground out of love and respect for each other as to how we're going to deal with this as a church, as a society, as a family. Thanksgiving, for example, how are we going to deal with that? It's like, Grandma Martha's cookie recipe. Grandma Martha may not be able to tell you exactly what her recipe is, but she makes the best cookies on the planet, right?
Yeah.
But can she tell you, well, you got to have this, and you got to have this, and you got to have these components, but she can't necessarily write that down, right, and hand it to you, and you be able to duplicate exactly Grandma Martha's cookies.
Yeah.
You're not going to be able to do that. So we need to come up with those consensus elements. I feel like the church so far has done a really great job of giving people flexibility, not being dichotomous, and coming up with a loving, neutral approach to the whole thing. And I think that's what we need to continue to do and understand it's going to change.
Can you give me a haircut in the final version?
Sure.
Like Ray from Star Wars.